in a productive way, we can solve our problems. And that's exactly what he's doing. And there's one big misnomer out there right now. Everybody says they hate Obama's health plan. Obama doesn't have a health plan. President Obama said to us in the Congress, I have principles. I have priorities that I want to see us reach in a health care reform package. And I want you all to put that together. And he set us to work in doing that, and that's what we're in the midst of doing. And we're working hard to do that. Some of you all have seen what's come out of the House plan. Well, it's not finished. It's come through the Energy and Commerce Committee. You've got a Senate plan that's come through the Health, Education, Labor, and Pensions Committee. Both of those committees are charged with health care and looking to bring about health care reform. But they have a narrow perspective of what their jurisdiction is over. It's mostly over policy and looking for the ways that we solve the challenges we face and how our health care is delivered in this country. I sit on the Senate Finance Committee. And unfortunately, or fortunately perhaps, I think it's fortunate because I asked to be on that committee on your behalf. We are taxed, but that's not part of the work. We are charged with the responsibility of not only looking for the policy that works, but how we pay for it. Because we all have the commitment that we can and we will and we must produce a health care reform bill that is budget neutral. That's what the president has asked of us, and that's what we're going to do. We can not only produce health care reform, we can produce it in a way that it is budget neutral. The CBO has told us there's over $700 billion worth of savings in the inefficiencies that exist in our delivery system today. Not to mention the $14 to $20 billion worth of fraud and abuse. Our commitment should first be to look at where those inefficiencies and fraud and abuse exist to help pay for how we are going to change and reform healthcare. Reforming healthcare means we need to take our system that over the last 50 years has been focused on reimbursing for volume. It's been reimbursing basically for volume instead of value. Well, that's not what we need to do. We don't need to reimburse or wait until people are their sickest to reimburse for their care. We need to shift our focus to looking for value and quality outcomes, not to mention making sure that we're looking at wellness and prevention. Because if we're administering wellness and prevention, guess what? People are less likely to need the most acute, expensive hospitalization, long-term care, emergency room, which are the most expensive venues of healthcare delivery. This is common sense, folks. It's not going to be easy, but we can make this happen. We can. As we look forward to what we need to do, one of the things I have realized is that, yes, we need to eliminate the inefficiencies. And in eliminating those inefficiencies, we will be able to pay for the majority, if not all, of what we want to do in healthcare reform. And what do we want to do in healthcare reform? We want to stabilize. We want to stabilize our costs so they're not up and down, and so that they're not a disproportionate share of your paycheck or your income. We want to stabilize coverage so that you're not going to be denied coverage for a pre-existing condition, or that you're going to be denied coverage because you've gotten sick and all of a sudden your insurance company doesn't want to cover you. We need to stabilize what is existing and that works and make it better. We also need to look for quality. We need to make sure we stabilize that quality in a way that allows you to get what you need, when you need it, and from the doctor that you choose. And we can do that. Many of you all do that now in a program that you're in. So we know that 46 million Americans that are uninsured need to be insured, because when we insure them, we can get our arms around them. Just as the pastor said in his prayer, we need to take care of everybody. And when we do, everybody is better off. Those that are covered are going to see a lower cost and a higher quality, because we're going to shift our focus to quality and value and wellness and prevention. And that's going to make